Taking Care of You, an educational program brought to you by the UCSF Neurosurgery Inpatient Caregiver program. Hi, my name is Margaretta Page. I'm a nurse here at the UCSF Medical Center and a member of the Neuro-oncology Caregiver program. We have created this presentation for you in order to supplement the information you and the patient receive at discharge. Being a caregiver is a challenging, rewarding, and a very important role. That said, most people are not prepared for this role, and it is normal to need some support. Our focus today is on what is the most important information and tasks that you as the caregiver may need to know in the first 2 to 3 weeks after surgery, as well as give you some tips for getting organized. The role of the caregiver. Rosalind Carter once said that caregiving is universal. In fact, there are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. A caregiver is anyone who provides basic assistance and care for someone who is frail, disabled, or ill and needs help. Caregivers can be family members, friends, or be hired help who perform a wide variety of tasks to assist with someone's daily life. Caregivers are often involved in one or several tasks to assist a patient's recovery after discharge from the hospital. These are some of the tasks or things you may be involved in doing after the patient returns home. Organizing and administering medications. Monitoring medication side effects. Communicating with the healthcare personnel. Assisting with physical and occupational therapy. Managing and observing the surgical incision. Becoming familiar with insurance benefits and claims, and managing the family business, legal, or financial matters. And last but not least, the very routine tasks around the home of cooking, cleaning, laundry, and transportation. Upon discharge. Prior to discharge, it is standard protocol to instruct the patient and a family member about the medications he or she will be taking after leaving the hospital, as well as specific discharge instructions regarding recovery. If after discharge you feel that you have additional questions, review the materials given at the time of discharge, both the printed materials and this video. If questions still remain, contact the neurosurgery office at 415-353-7500. It's always a good idea to have one other person besides the patient who knows or has access to a list of the patient's medications. This is for a few reasons. The main one is that if an emergency situation occurs and the patient is not able to communicate, someone needs to be able to let the healthcare team know what medications the patient has been taking. In addition, in the immediate postoperative period, a patient's memory may or may not be 100% back to normal. It's always good to have an extra set of eyes to look over the list and make sure that things make sense. Prior to discharges, the nurses and the pharmacist will review a list of the medications to be taken at home. Take your time to review the list and make notes so that you know what the medication is called, what it's for, and what dose the patient should be taking. It's always okay to ask questions. This medication list will be printed on something called a patient discharge information sheet. Patient discharge information regarding medications. The medication sheet will be printed out. It will be part of a packet titled Patient Discharge Information and is specific for each patient. This is what the medication sheet will look like. Note that we have listed the name, dose of medication, instructions, and even a graph to keep track of medication times. Sometimes it's helpful to see it listed this way. When you get home, you and the patient can work together to develop a more permanent medication list or log with this information. You can then remind the patient to bring it and update it at each doctor's appointment. There are a variety of ways to keep track of the medications. The simplest is to create a handwritten list. Others prefer to type the information out on their computer or their tablet. If you like your phone, there are many smartphone applications available for this task today. You will need to select the one that seems like it will work the best for you. We strongly recommend that all families use a pill box. You can fill it alone or with the patient at the beginning of each week. Be sure to use that medication list in order to reduce errors. The pill box also allows you to keep an eye on whether or not the medications have been taken as directed. One final tip: for midday medications, some people like to set a timer on their or the patient's phone or watch to help them remember to take their medications in the middle of a busy day. There are several medications that are commonly prescribed after surgery. They include dexamethasone, sometimes anti-seizure drugs, medications for headaches, as well as medications to prevent ulcers and constipation. I'm going to discuss two of the main medications prescribed to most patients. Dexamethasone is a steroid that is prescribed before and after surgery to help decrease inflammation and swelling in the brain. Swelling and inflammation are the body's natural response to a surgical procedure and usually decrease or subside over a few weeks following the surgery. A common name for dexamethasone is its brand name, Decadron. Dexamethasone, or Decadron, can have many side effects. I'm going to mention just a few of those that cause concern after discharge. In the next few days to weeks, it would not be unusual to see some mood and personality changes, particularly increased irritability or edginess, increased appetite, extreme energy, and difficulty sleeping. These are normal and a direct and very common side effect of this medication. These symptoms should improve as the patient is tapered or gradually reduced off the drug. A patient should never stop Decadron or dexamethasone without tapering off or instruction from their physician. Part of the discharge instructions may include a calendar for how to taper off the dexamethasone. It is important to keep in mind that each person reacts to drugs differently and that if any of these symptoms become severe or extreme, please contact the neurosurgery team right away for advice. In addition to the steroid, one of several anti-seizure medications may be prescribed. Although not for everybody, it is not unusual for the doctor to prescribe these kinds of medications in the immediate period following surgery to prevent a seizure from occurring or for those patients who have a history of seizures. Side effects of this class of medication may include, but are not limited to, fatigue, mood or personality changes, and depression. These drugs may also impair thinking and slow reaction time, particularly when the medication is first started or the dose is adjusted upwards. Additional symptoms may include rash, hives, difficulty breathing, or swelling of the lips, tongue, and jaw. These symptoms may indicate an allergic reaction, and you should contact your doctor's office for advice, unless the patient is having trouble breathing, in which case you should seek emergency care immediately and call 911. It is important to remember that sometimes there is an adjustment period to these medications and that some of these symptoms will improve over the next few weeks. If you are concerned about a new or worsening symptom, please don't hesitate to contact the neurosurgeon's office right away. In addition to medication instructions, the patient and caregiver will be given specific instructions about what to expect after discharge. The types of information you will receive may look like these documents. Please see your discharge summary for specific instructions and information about follow-up care. You will see in this example, we see information about what to expect, activity, diet, and care of the incision. After a brain surgery, going home can feel a little intimidating to all those involved. Please rest assured that your family member's doctor will not send your family member home until he or she is stable and it is safe. Your loved one did just have major surgery, and there are a few symptoms or side effects that you should be aware of. I'm going to review those that are expected and others that might warrant a call to the neurosurgeon's office. Headaches are a normal symptom after brain surgery and are usually related to the swelling that results from the surgery. The skull can only accommodate so much volume, so if there is swelling, it can cause increased pressure. The kinds of headaches patients experience vary by individual. The thing to remember is that some headaches are normal and should improve over the next several weeks. If your loved one is experiencing a headache, they should be encouraged to take the pain medication prescribed by the doctor. You should contact your doctor's office if the patient is taking the pain medication as often as directed and the headache is still not relieved. You should be aware that some patients who experience an increase in headaches as the dexamethasone or steroid is tapered off. If this is the case and the headaches do not respond to the pain medication, it is important to contact the neurosurgeon's office. Depending on the location or extent of the surgery, patients may go home with symptoms that they did not have prior to admission. These may include weakness, problem speaking, thinking clearly, or trouble staying awake. These may occur immediately or within the first 72 hours after surgery, and then hopefully resolve over the next several weeks. New neurological changes can also occur as a result of the decadron taper, which often means that there's persistent swelling that must be addressed. Observe if the change ebbs and flows throughout the day. Some patients do have more symptoms that are noticeable when they are fatigued. This is normal. If, however, the symptom steadily progresses or worsens, please contact the neurosurgeon immediately. The doctor will help you evaluate the taper of the decadron or other potential causes for the change in condition. There are a few things that can happen in this early postoperative period that are considered complications. The first is a seizure. A seizure is a disruption of the electrical signals in the brain and can be a side effect of the surgery, swelling, or the presence of a tumor. Roughly 30 to 40% of patients with tumors may experience seizure activity at some point during their illness. One of the scariest things to witness at home can be a seizure. A seizure may be small and involve single or multiple twitches or jerks. It can be tingling or loss of ability to speak, or what we call a grand mal seizure, in which there is loss of consciousness and body tone, followed by big twitching and relaxing muscle contractions. Seizures in patients with known brain tumors and post-surgery are not necessarily an emergency. Most of the time, a person having a seizure requires no assistance other than observation. Hi, my name is Margaretta Page, and I'm a nurse here at UCSF. I wanted to take a moment to review with you what you should do in case your loved one has a seizure. The first thing to remember is that it is not an emergency. Seizures are self-limiting, meaning they usually stop on their own and only require an observation. The next rule to remember is not to panic. This is easier said than done. You may need to say to yourself, this is not an emergency.
Once you've determined that a seizure is occurring, do your best to assist the patient to a safe position. This could be sitting or lying down on the floor or a bed. The key words here are to do your best. Clear the area around them of any sharp or dangerous objects, which includes protecting their head from bumping something. Fold a jacket or a small pillow under their head. Make sure they can breathe. Move all pillows, blankets, and clothing away from their mouths. Do not put anything in the patient's mouth. They will not swallow their tongue. Do not attempt to restrain their limbs. Stay with the patient and let the seizure run its course. This can feel like an eternity. When possible, after the seizure is over, roll the patient on their side until they have recovered. Bend the knee and pull their arm across their body. Pull them towards you. The patient will gradually wake up. Speak softly. Tell them what happened. You had a seizure. And have them rest until they are fully recovered.
What you see, can you please see me? Turn around for one look more. Lock the door that saves the key. See a light. Be alright.
After a seizure, you may notice the following things. The first thing to remember is that most seizures last a maximum of 2 to 3 minutes. This can feel like an eternity. Patients having a grand mal seizure may have short periods of 30 seconds of not breathing at all and may turn dusky blue. This is a normal part of a seizure. They will then take large, snoring-like breaths and may not be responsive for several minutes. After a seizure, most patients are sleepy and may be confused, but they do recover. Patients may have a brief weakness or numbness in the affected limb. Patients should be encouraged to rest until they feel like themselves again. Although it's not an emergency, it is important to let your neurosurgeon know that the seizure occurred, as a medication change may need to be made. In most cases, a trip to the hospital or a 911 call is not required. However, there are a few situations where an emergency intervention might be needed and you should call 911. For example, if the patient stops breathing completely, has been injured during the seizure, or if the seizure goes on longer than 5 minutes, or a second seizure follows the first, at this point it's appropriate to call 911. Another potential complication is a blood clot. Having surgery and a brain tumor increase the chance of a patient developing a blood clot in their legs. Although not expected, a blood clot is not unusual. If you notice swelling in the ankle or the leg, or there is pain in the leg, and usually it is one leg, not both, or you note redness on the skin, it may indicate that the patient has developed a blood clot in that leg. You should alert the treating doctor or take the patient to the emergency room or urgent care if you are unable to reach your physician. A complication of the blood clot in one's leg is that it can break off and travel to the lung. This is called a pulmonary embolism. Symptoms of this include chest pain, shortness of breath, and rapid heartbeat. This can be a life-threatening situation and needs immediate attention. Call 911 or proceed to an emergency room for an evaluation, should this occur. Lastly, as a result of surgery, a patient can be at risk for wound complications. Complications include infection at the incision site or impaired healing. These are indicated by redness, swelling, leakage of fluid, or fever. Because of the location of many of the incisions, you, the caregiver, may be the only one to get a good look at that incision on a regular basis. It's a good idea to get in the habit of taking a quick look at that incision each day. If you notice any signs of infection at the incision site or impaired healing, please contact the neurosurgeon's office right away. Now I'd like to spend some time on what to do when you get home with someone who has just had brain surgery. As I mentioned before, going home so quickly after such a big surgery can feel a bit scary. Do you have a question? It would be unusual not to have at least one. Always refer back to the discharge information given to you by the hospital team. Many of the things that you might be wondering about when you get home, like exercise, shampoo, or activity, and others, are on the sheet that were given to you and the patient prior to discharge. Be sure to place these sheets in your binder or another safe place. Here's another photo example of the types of documents with the discharge information that the patient should have received at the time of discharge. A form called the Patient Discharge Instructions will be given to each patient and hopefully you. These instructions include the plans for follow-up with the doctor after discharge, a medication list with detailed instructions, and specifics about what to expect as far as activity, diet, and other things. If you have a question about something that you feel is related to the surgery or side effect of the surgery or medications prescribed after the surgery, then contact the surgeon's office at 415-353-7500. If you have a question about another medical condition that the patient had prior to the surgery, for example, high blood pressure, diabetes, or a thyroid problem, we would recommend that you contact the original doctor who was treating that condition. And if you are not sure, at least in the early weeks, contact the neurosurgeon's office and they will help you decide who is the best person to handle the problem. Caregivers often wonder when they should call for help. Do not hesitate to contact the neurosurgeon's office or the nurse or on-call MD for the following symptoms or situations: severe or increasing headaches, significant nausea or vomiting, increased weakness, changes in vision, or changes in sensation, a change in the patient's ability to stay awake during the day, drainage, pain, tenderness, redness or swelling at the incision, or failure of the incision site to close and heal, pain, redness, tenderness, or cramping in one or both calves, or leg or ankle swelling. The neurosurgery phone number is listed on the discharge documents at 415-353-7500. We know that being a caregiver can be both rewarding and exhausting. It is important to know this at the outset and that you understand that it is important, if not imperative, that you take care of yourself. As a family, you will need to decide who is the primary caregiver and who is the caregiving team. Once you get home, getting organized will be important. This may not happen all at once, as it's a process. But the fact is, the more organized you are, the more prepared you will feel. You will also feel like you have more control when making decisions. You will likely prevent errors and have easy access to accurate information. One method to help with organization is to create a healthcare binder. This helps keep you focused, organized, and feeling in control, especially in an emergency situation. You can use the caregiver binder that came with this DVD. We have also included a pocket for the CDs and MRIs and a page for the business cards of your healthcare team. We've also included divider tabs so that you can organize the binder any way you like. Possible sections for you to consider include a health history section, medications, treatments, a notes section, insurance and legal sections, and then it's up to you. You could add resources and information, calendars, MRI reports. I've actually added some sample forms for keeping track of medications and the health history in the back of the binder. In addition to organizing, it will be helpful if you can take a few moments and prioritize what are the most important things that you need to get done. You only have to focus on managing the next several weeks. Perhaps for now, focus on the next 4 weeks. We recognize that the responsibilities associated with being a caregiver described above are in addition to the roles and responsibilities that you already have in your family. Some people wonder how on earth they will ever manage. One way of managing is to break the job down into small pieces. Some questions to consider are, what are the roles and the tasks that you did before the illness, and what are the roles and tasks that your loved one did, and what, if any, can they continue to do at this time? Examples of roles or daily tasks that you might have performed may include working, taking care of the garden, meal planning, meal preparation, or carpooling the kids or grandkids. Examples of the roles or tasks that the patient might have done include taking out the garbage, shopping for groceries, working, managing the household finances, and walking the dog. You have to ask yourself, what can the patient still do? And of the roles or tasks that they can no longer do, which one of those jobs can you take on? Remember, friends and family members will want to help. Think, which of the roles, whether it be yours or the patient, might be good to offer to volunteers? Examples of tasks and roles that are easy to delegate include carpools, meals, and driving to appointments. Finally, you have to be honest with yourself and ask, can I do this? If you say yes, you need to think, how much can you do, and what exactly do you want to be responsible for? Set reasonable limits. Sometimes you know that you just can't do it, and if you think it's not possible to be the primary caregiver, then who can it be? If this is the case, it's important to meet with your family and contact a social worker to discuss your options for caregiving. Do not be afraid to ask for help from family, friends, and others. If the patient is up to it, it would be nice if together you could identify the roles and responsibilities that you held prior to the illness. Try to divide the tasks into routine tasks and those that involve actually caring for the patient. Routine tasks include food preparation, grocery shopping, cleaning the kitchen, etc. They may also include the following managerial duties. Managerial duties are those that are involved with the management of the household. They include the finances like banking and bills, applying for social services and financial assistance, as well as managing insurance and attending to legal matters like advance directives, power of attorney, as well as managing all the medical appointments. Transportation includes the actual driving or assisting with transportation to medical appointments, recreational activities, and running errands. You may want to consider getting a disabled parking placard from the DMV to make things a little easier. And lastly, there are the household chores. These include the very basics of food preparation, which involves the planning and preparing and serving of meals. In addition, someone needs to buy the groceries and clean the kitchen. Also in this category are the general housekeeping tasks of laundry, gardening, and perhaps pet care. Review what were the things that your loved one did prior to the illness, and who can help now. For example, who can manage the pets, or the children, or the elder parents, or the other tasks. There will be some new tasks after the surgery, and those are the ones that are what we call involved in hands-on patient care. Things in this category might include in-home supervision and companionship to provide the patient with comfort and safety. Those tasks involved with personal hygiene. Does the patient need help with bathing or showering, brushing his or her teeth, and skin and hair care? Some patients actually need true medical or nursing care after they're discharged from the hospital, which means the administration of medication and or lifting in and out of the bed. And lastly, as the patient's condition permits, you'd like to offer opportunities for recreation and respite with the family. When thinking about these tasks, there are a few things to consider. What, if any, needs exist? Look at what were your loved one's prior responsibilities and what can he or she do now. You also have to ask the patient, who are they comfortable with receiving this kind of care from? This is a very important question. On a side note, one of the hardest things for caregivers is that it is very hard to plan. Conditions can change for a variety of reasons on a week-to-week, if not day-to-day basis. Most patients' conditions will at least level out, and some get stronger as they recover from the surgery. However, at the same time, there's going to be an additional burden of appointments with other specialists that may or may not be involved in treating the tumor. As a caregiver, you can try to have a plan, but at the same time, you will need to learn to be flexible and prepared to let things go if necessary. Now, back to our tasks. The next question is, who is available to help? Explore your options for help. It could be a friend or family or even hired help. The goal is to create a care team. Identify the tasks that you and the patient are willing and comfortable offloading to others. And finally, if you do think it's just too much to try and organize all of this, particularly at the beginning, it is okay to decline help. Sometimes too many people in and out of the house can be overwhelming. You may say to yourself, oh my goodness, even thinking about the jobs is overwhelming. Some people delegate this task to a good friend or another family member to help with. He or she can be your task manager and develop a system to coordinate the help from others that has been offered. A good example of some of the online tools that helps with organizing volunteers and also keeps all of your friends and family informed are Lots of Helping Hands and Caring Bridge. Use your close helpers to assist with a task like this. I'd like to close with perhaps the most important, and for some reason for most of us, the most difficult task. This is the task to take care of yourself. It's true that in order to provide the best care for your patient, you need to be as healthy as possible. These are just a few tips to get you off on the right foot. The next weeks, or in some cases longer, can be a very stressful time. You need to recognize this and prepare yourself, and do try to take care of yourself. It can and will be challenging, but there will be positive moments, and these will sustain you through the next part of the journey. Caring is like running a marathon, and you need to nourish yourself along the way. It's very important to get good habits in place right now at the beginning. Exercise. Ideally 30 minutes of moderate to vigorous exercise per day. Eat well and make sure that you get enough sleep. Take care of yourself. Make an appointment with your primary physician if you haven't seen them lately, and if you're under a doctor's care, by all means, keep up with your appointments. It's extremely important that you make special time for yourself. You need time for pleasure and self-renewal. Let yourself go to the movies, read a book, or visit with friends. Find something pleasurable and get into the habit of enjoying something each day. Try not to close yourself off to invitations from friends and relatives. At the first visit with the doctors after surgery, take time to meet with the caregiver team. And consider joining a support group for you or for you and the patient. If you are finding that you still want more information, we'd like to make some suggestions. What's available on the internet and from friends and family can be overwhelming and is not always accurate. It's a good idea to limit the information that you look at least for now, or perhaps focus on a few trusted resources. Some of those that we recommend include the American Brain Tumor Association, or the ABTA, the Musella Foundation, and our own UCSF Neurosurgery website. In addition, we've created some basic resources on brain anatomy and brain function that you will find on the Resource tab as part of this DVD presentation. This binder and DVD was made possible for caregivers by a very generous donation to the UCSF Neuro-oncology Caregiver program from the family of Tiffany Kalmbach and the Cancer League of the East Bay. We are very grateful for the donation and the opportunity to be able to provide care not only to patients, but to their families as well. In addition, I'd like to acknowledge the following people who, without their careful review and production, this presentation would not have been possible. Idana Molina from the UCSF Neuro-oncology Caregiver Program, Marlena Burt from the UCSF Department of Neurosurgery, and Dr. Susan Chang from UCSF Neuro-oncology. The following are some slides that we've provided to offer you additional information about basic brain anatomy and function. Brain anatomy and function. Sometimes understanding brain anatomy and the function of the different parts of the brain can help explain why certain things are happening. The brain is divided in half into hemispheres, the left brain and right brain. Each side has different functions, all of which contribute to making us who we are. Broadly speaking, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. In addition, the brain is divided into lobes, with each lobe controlling specific functions of the brain. The frontal lobes are at the front part of the brain, and it is here that we find the motor strip that controls the movement on the opposite side of the body, as well as the production of speech. We also find many functions associated with intelligence, thinking, memory, personality, and behavior. The parietal lobes are involved with the processing of sensory information. It's here that one finds the sensory strip in which sensory information about the body is processed. For example, the feelings of hot or cold. In addition, depending on the location, problems in the parietal lobe can affect one's intellect. Patients can demonstrate problems with the processing of math problems, and on occasion, lesions in the parietal lobe can affect speech and motion, and occasionally one's ability to understand abstract concepts. The temporal lobes are involved with perception, hearing, emotions, understanding speech, and memory. Tumors in this area can cause certain types of seizures that may be déjà vu, or feelings of déjà vu, or auditory hallucinations. The cerebellum, which is at the back of the brain, controls fine motor movement and coordination. This area helps with balance. The occipital lobes are involved with vision and perceiving what is seen. Damage in this area can cause loss of vision or visual hallucinations. Brainstem lesions can cause symptoms such as vomiting and clumsy walking, trouble with tongue movements, swallowing, and speech. Hearing and eye movements are also controlled here, as well as our vital functions like sleep and wake, and breathing and heart rate. For more information on the UCSF Neuro-oncology Caregiver Program, please see our website on the link below.